Well, we're back. We're back with our quarterly update with none other than Dr. Fisher. Because you know what? We've got lots of things to talk about, like booster shots and flu shots and what's up with the kids and what's up with wearing our masks. Because we're not out of it yet, folks. We're not out of it yet. So stay tuned and let's see what Dr. Fisher has to say. Hi, everyone, and welcome to Scan FYI. So yeah, this is our quarterly update with Dr. Margaret Fisher. So Mary Beth, I know you wrote down those titles.
I'm going
to let you introduce.
Good morning, Dr. Fisher. How are you? So yes, Dr. Fisher is Medical Director of Clinical Academics of Excellence with Monmouth Medical Center and Special Advisor to the State Commissioner of Health.
Yes, that's and so Dr. Fisher, it's really been such a pleasure for us to have you with us like this quarterly. And, you know, as we said before, we're still talking about it, but there's always something new happening. And maybe Mary Beth, maybe a good thing to start off is with booster shots. What's happening, right?
Yes.
So Dr. Fisher, what's so many questions about the booster shot. So what do we need to know?
Sure. So the first thing you need to know is there are third shots and there are booster shots. And I'm going to distinguish between them. The third shots were recommended in let's see when. Let me see. The third shots were recommended in the middle of August. Okay, so third shots were recommended the middle of August, and those are for people whose immune systems are not very good. So people who have immune problems, either because of medicines they take or underlying illnesses, they need an extra shot to give them the same protection other people get with just 2 shots. So for people who got either Pfizer or Moderna and their immune systems are not up to snuff, they should get a third shot with the same vaccine. So a third Pfizer or a third Moderna. Now, just last month, the booster shots came out. So booster shots currently, as of this day, are recommended for Pfizer. And these are people who have already gotten their 2 Pfizer shots.
Right.
It's been 6 months. Okay.
Right.
They should go ahead and get a booster shot. So 6 months after your second Pfizer shot, you are eligible to get a booster if you are 65 years of age and older. So that very young age of 65 and older people, or if you have underlying medical conditions and you're between the age of 50 and 65, then you absolutely should get a booster shot of Pfizer if you had Pfizer to begin with.
Would you give some examples so people understand when we say underlying medical conditions, what are we talking about?
Sure. So those are things like cancer, kidney disease, lung problems, heart problems, high blood pressure, diabetes, pretty much any chronic illness that makes you have to go to your doctor on a regular basis. Talk to your doctor, or if you don't have a doctor right now, if you have one of those conditions, go get this booster shot. You don't need a doctor's note. You don't need anything at all other than you attest to the fact that you need a booster shot. The other group of people who may get booster shots are people who are 18 to 50 years old and have those underlying medical conditions, or anyone who works in a job that makes them more likely to be exposed to COVID disease.
Okay.
Healthcare workers, frontline workers, police, fire, teachers, grocery workers, anyone who gets in regular contact, all of our transportation people, anyone whose job or living setting, so people in congregate living settings, anyone that either their work or their living circumstance puts them at risk for coming into contact with COVID should get that booster to give them added protection. Okay. Now,
what about Moderna? Because you mentioned Pfizer.
Perfect. So what about Moderna and what about Janssen? So for the Moderna vaccine, they are testing a slower dose to give as a booster. And they have turned that information into the FDA. And on October 14th and 15th, the advisory group to the FDA, FAAP, will be meeting, and they're going to discuss on the 14th of October, they're discussing the Moderna boosters. And on the 15th, they're discussing the J&J booster. So we don't know yet what those recommendations are going to be. We suspect they'll be similar. The J&J may be a little more expansive because J&J has shown that a second dose of its vaccine increases its efficacy way up into the 90%. So there's going to be a lot of changes over the next few weeks. Here's another big thing happening. On October 29th, the advisory committee is meeting to talk about Pfizer's information of giving the vaccine to children as young as 5. So right before Halloween, we may have an expansion of the emergency use authorization for children down to age 5. And that will really give us added ability to give those layers of protection for our children who are in school, because we know how important it is to keep them in school.
Right. So if you've had the Pfizer shot or the Moderna shot, whichever one you got, or J&J, you need to have, and you're going to get a booster, it needs to be the same. It's got to be the same. We don't mix and match this.
Correct. As of now, there's no mixing and matching. That is being studied. And in fact, for those immunocompromised people that are getting that third dose, if for some reason they can't get, if they got Pfizer, but they can't find a Pfizer and they can get a Moderna, it's okay just for that group. So just for the immunosuppressed. And if they got Moderna and they can't get Moderna, but they could get Pfizer, they can go ahead and get that third dose with Pfizer. But in general, the recommendation is don't mix and match yet. We don't have enough information about the safety and about whether it's as good, maybe it's better, but maybe it's worse. So until we know that, let's nix on the mix and match.
Okay.
Dr. Fisher, is a doctor's note required for the third vaccination? No.
Absolutely not. So from New Jersey from the start, it's been self-attestation. As long as you say you're whatever age you need to be, or you have an underlying condition, that's all you need to do. And remember, you don't need insurance. You don't need to be documented. You don't speak English. You don't need, all you need to do is go find yourself a place where they're giving vaccines and get it. And if you're homebound, then call your local health department and they'll bring the vaccine to you. So we really want everyone in New Jersey who can be vaccinated to get vaccinated and be protected. Because
I think you're making it easier too, even if you're home. So even if you're homebound, that you can get a vaccination.
Absolutely.
So so if you are over 65 or whatever age you might be, and so let's say you don't have any of these chronic conditions, a booster is really not necessary. I mean, I'm hearing people talking about booster shots, and maybe they're not even realizing that it's only intended if you have some chronic situations.
So actually over 65 qualifies you for a booster.
Oh, just being,
All you do is be older
than
65, which, you know what I say, older is 10 years older than I am. So
way.
Pretty darn young.
20 years older than I am.
There you go.
So Dr. Fisher, what about the children and the school children?
Yeah.
Where are we at with these?
So from my perspective as a pediatrician, it's really been wonderful to see children be able to go back to school.
Yes.
And certainly there have been some cases in some schools where there have been cases and children have to go home or be quarantined or be isolated. But most children are still in school. They're getting that in-person education that is so important for them. It's so important for them socially, and it's so important educationally. we want them to be taught by our teachers who are the experts at,
Right.
giving care or giving, the lessons. So it's really great for them to be in school. But in order for them to be in school safely, there are several layers of protection that we can give them. The first, our governor, bless him, has said that everyone inside a school building has to be masked. So both
Everyone.
the staff and the student, everyone. So you cannot walk into school without a mask. And again, remember, I always give the reminder, the mask is worn over your nose and mouth, okay? And the reason we need the mask is if you're infected and you don't know it, you may be spreading virus every time you say a word, every time you breathe. If you have a mask on, the virus is caught on the inside of that mask and can't go out into the air and make people sick. If you're not sick and you have the mask on, every bit of air you're breathing in is being filtered by this mask. So if you ran into a virus, it's stuck on the outside of the mask, it doesn't get into you. So masks, very inexpensive, very effective. Children tolerate them very well. So that's for everyone that's in the school building. Now, the next thing we have are the distancing. So we want people to stay physically distanced. And what we learned last year was in school, 3 feet apart is enough. 6 feet might be better, but 3 feet's enough. So we want to try to keep the desks and the children at least 3 feet apart. So 3 feet apart really protects them. Then we have the mandate that all teachers in New Jersey have to be vaccinated. So that's another layer of protection. The next is children 12 to 18 or 12 and older, till you get to be an adult. They are eligible for vaccine right now. And we've vaccinated about 60% of children between the ages of 12 and 18. We've already gotten them vaccinated with at least 1 dose, and about 50% have gotten both doses. And remember, they have to get Pfizer because that's the only one available for that age. By Halloween, I am hoping that we're going to have a vaccine for children 5 to 11. That will be the Pfizer vaccine, and it will be a much lower dose. It's a third of the dose that's given to the older children and the adults. Why a lower dose? Because a lower dose works in those youngsters because their immune systems are just more vigorous. So the lower dose for them, and then maybe by the end of this year or early in next year, we'll have a vaccine for children down to age, and I'm not sure how low they'll go, whether it'll be 6 months or 3 months. We'll have to wait and see on that.
All good news.
That is all good. A lot of changes. Every time we speak, there's a lot more happening, and I'm sure the next time we speak, though, I can't even imagine. But the point is, though, obviously, we still have to take our precautions. We can't act like it's over because
it's
I
not.
guess it's not over. And so, what about flu shots? What about the timing with, if that's even an issue, a booster shot and a flu shot, or do we still need our flu shots? What are we doing about that now?
Absolutely, you still need your flu shot. We don't know what flu is going to bring this year. I have to look into my crystal ball.
Please do.
I'm
Yes.
hoping that we'll have a year similar to what they saw in the Southern Hemisphere. And that was a very, very mild year. However, if we're not careful, it is possible we could have a bad flu season. And remember, we didn't all get boosted from having the flu last year because there was literally no flu or almost no flu in New Jersey. So it's really important to get that shot to boost your immunity, to wake up your immune system, to give you new protection, and also to remind your immune system about all the flus you've ever had in your lifetime.
Right.
So go get your flu shot. We want everybody to be immunized by the end of October. So now's the time. Go ahead and get it. if you're older, if you're that young 65 or a little bit older, then you have available a high dose vaccine to give you a little extra boost. So we know the immune system doesn't work so well. It doesn't work, I shouldn't say so well, it doesn't work as well when you're 65 and older. So we give it a little bit more of a punch to try to make sure that you get the same reaction that a younger person would get. So go ahead and get that flu shot. And for your children, for children under 8, they need 2 doses if they didn't have the flu vaccine before.
Oh,
So you really want to get them, like right now, go ahead and get their first dose in case they need a second dose a month later. For children over 9 or children who have already been vaccinated in the past, they just need the 1 dose.
Okay. And what about getting the booster shot in conjunction with the flu shot? Should you be waiting I've heard like a 2-week time frame.
No waits anymore.
Don't need to wait.
So when we first started to give COVID vaccine, we said, don't get any other vaccine within 2 weeks. That was changed way back in May.
Okay.
So we now know it's perfectly, thousands of doses have been given together with other vaccines. So you can get your flu shot in one arm, your COVID vaccine in the other arm, or if you want to do them both in one arm, you can get them in the same arm. They just do it an inch apart.
Okay.
So, and if you need more than that, like let's say you need a tetanus shot, go ahead and get it all at the same time. Yes, you'll have painful arms.
very sore arms for a while there. Yeah.
You'll only have it for a couple of days, and then you have to spread it out over a month.
Right.
No, why do you want to have 2 painful episodes? Just, go for it. Get them both at the same setting.
All right. Well, that's good. That's actually very good news then. So we get everything over in one fell swoop.
Right.
And I think our other 2 vaccines are pneumonia and shingles, probably for our older population.
You got it.
Yeah. Because shingles is, I know someone right now who she never had the shingles shot because again, it won't happen to me. Yeah. And she sure wishes she had, because that's a pretty awful thing to get.
Shingles is a very severe disease as far as the amount of pain that it causes. So it starts out with pain and itching, it then spreads, and the pain after the rash goes away, the pain can last for months to years. And it can be incapacitating. And I think anyone who's had a bad back or had any kind of painful event knows that pain really makes it hard to be your usual, productive, happy self. When you're in pain, it's hard. You don't sleep well. You just, and if you don't sleep well, you're irritable. It's just not a good situation. So save yourself that pain. Get the Shingrix shots. You need 2 shots.
Yep.
They can be as close, I believe, as a month, but they can also be spread out. You could get one now and one in 3 or 4 months. But get those, it's called Shingrix. Go ahead and get that Shingrix shot. And even if you had the first shingles vaccine, the Zostavax, Shingrix is a more effective vaccine. So even if you had Zostavax, go ahead and get Shingrix now and get both doses so that you're fully protected.
I feel like, like a puppy. I've had all my shots. But to recap, so everyone, the flu shot, the shingles shot, the pneumonia shot, if you haven't, and potentially the 3rd shot or the booster, depending on your needs. So there's a lot of things that we all need to, be up to date on this.
Exactly.
And then, of course, share because a lot of these things you can go to your Walgreens or CVS, that sort of thing, and make sure you keep all the info and share it with your doctor so your doctor knows that, what's all happened to you.
Yeah. And a lot of times you'll hear people say, oh, I don't have to get those anymore because we can treat pneumonia with antibiotics. We can treat the shingles with, we have antivirals for that. And now there's a pill for COVID. So I don't have to worry about any of these things. Let me tell you, prevention is far, far better than trying to treat a disease that you already have. Why make yourself miserable when you can prevent a disease? So vaccines always going to be the better, or prevention is always going to be the best way. Not getting an infection is much better than having to treat someone who got the infection.
Yeah.
Well said.
What are your thoughts about when folks who've had their two vaccines and they still wind up with COVID?
So we know that 2 doses of the vaccine is about somewhere in the 90 range effectiveness, but we know that over time that effectiveness tends to drop. So that for older folks, we know that by about 4 or 5 months, that may drop down from 90% down to 80-some%.
Oh,
And then we know in nursing homes, it actually drops down to about 50%. So that's what we don't want. And that's why we're really pushing for people, particularly people who have any underlying conditions. Get that booster, get yourself that added protection so that you don't have to worry about getting the disease.
but if you do wind up getting COVID after you've had your vaccine, would we say that hopefully it's a much milder version of it?
Yes, generally it's absolutely milder. As a matter of fact, sometimes it's so mild you don't even know you're infected, which is
Why
why
you need to wear the mask.
very important.
Yeah.
Because you don't want to transmit it to other people. So yes, it is generally mild. But again, if you're an at-risk person, if your immune system isn't quite so great, unfortunately, we have had deaths in long-term care, people who live in long-term care, fully vaccinated. They had a breakthrough case. They did require hospitalization, and there have been an occasional death. Now, that doesn't mean the vaccine doesn't work. The vaccine works very well. The vast majority of deaths today are in unvaccinated people and most of the hospitalizations, but there's always going to be breakthrough cases.
Mhm.
So as I said, let's say you have a vaccine that's 90% effective. That's great. But if you vaccinate 1 million people and it's 90% effective, that means 10% of the people are going to get sick. That's 100,000 people. So breakthrough cases are going to be common. You know, we shouldn't expect the vaccine to be perfect. And it's fortunate that most of those breakthrough cases are going to be mild.
So now that I don't want to say under control, because I'm not sure, I don't know if that's the right word, but now that we're out and about a little bit more, Dr. Fisher, what are still some of the riskier places for people to go when we do go out, that we have to be extra careful still?
Yeah. So you're right. We're seeing that hospitalizations are trending to go down, but our new cases, we still have over 1,000 new cases every day. So there's still a lot of disease out there here in New Jersey. So the riskiest places are inside with poor ventilation and unvaccinated people and people who don't have masks on. Those are your risks. So when you go to the grocery store, not everybody's going to be wearing a mask. So if you have any kind of risk, and even if you don't, go ahead and wear the mask. Protect others and protect yourself. So I would say grocery shopping, anywhere that you're potentially going to end up in a crowd, even if you didn't think that it was going to be crowded, have that mask with you so that you can put it on. As far as outdoor events, for the most part, outdoor events are, disease-free. So this is a bonus. You can go outside. You can do almost anything you want outside. Now, I'm not going to go to a baseball stadium right now. I'm not going to go to the World Series and expect that just because I'm outside, it's safe, because there are going to be thousands of people around.
Yeah, it's a very dense crowd, even though it's outdoors. Yeah.
So dense crowds, I'm not excited for that. Stay away from the dense crowds. Again, have your mask with you just in case you need it, but go outside, take a walk, go to the beach. This is my favorite time for the beach because there aren't very many people on it, and you just get to hear the ocean and smell the salt. It's gorgeous. And many of the beaches are open to pets now, so you can take your dog with you and really just have a wonderful time. So
we're lucky it's local season at the Jersey Shore.
Exactly right. Exactly right. And Sandy Hook's still open. So, go take a bike ride in Sandy Hook. You don't need a mask at all.
But as we're heading now into, the summer's over, right, Mary Beth? We're getting into the cooler weather. The holidays are coming like they do every year. And obviously living in New Jersey, we're going to be spending our holidays indoors. So what's some advice for that? Because
so if you know that everybody's vaccinated, then I'm pretty comfortable. You can all be indoors. If it's all family and you've been together before, you can even forego the masks. If a whole bunch of out-of-town people are coming in and they're from one of those states where there's really a lot of COVID right now, like North Dakota, Montana, West Virginia, then that would be the one where you might say, yeah, let's have a gathering, but let's keep our masks on and let's sit further apart at dinner so that we decrease our chances of transmitting the virus.
So if a family member is not vaccinated, I'm imagining that's going to cause some stress for a lot of people this year.
There's no stress at the holiday.
No, like we didn't have it. Right. This is extra stress, Mary Beth, because we all
awkward conversation.
We all need extra.
And most people's grandchildren, the ones that are under 12, are not going to be vaccinated. Probably aren't going to be vaccinated by, or maybe aren't going to be vaccinated by Thanksgiving. Maybe by Hanukkah and Christmas, maybe they'll have, they'll get vaccinated. What I would say for if you have adolescents coming to visit you, I would really encourage them to get vaccinated before they visit. And, you can make it a requirement. We have a vaccine household here. So anyone who comes in the door, we want them to be vaccinated. And it's perfectly appropriate for you to ask people coming in. We're actually redoing part of our house, and we ask the painters and everybody else, are you vaccinated? Because I'm not really sure I want you in my house with me if you're not vaccinated. So it's okay to ask those questions, and it's okay. Well, you know how relatives are, so I won't say that, but you can make some rules. I mean, it's particularly if you have any illness that puts you at higher risk. Upset the family if you have to, but let's keep ourselves safe, and let's especially keep our relatives who are immunocompromised safe.
Well, my house, my rules.
Yeah,
it's time that we got to enjoy the holidays. So.
You bet.
That would be nice.
And start encouraging them now so that they can get fully vaccinated before they come visit. And the ones who need boosters, remind them that, hey, you can get a booster now. It's still free. It's completely free, even though it's right now Pfizer, the Pfizer vaccine is fully licensed. Interestingly, it's a weird way that we license things, but the vaccine is licensed for the first 2 doses. The booster shot is still under the emergency use, and the vaccine in 12 to 16 is still under emergency use because it hasn't been 6 months since that's been recommended.
So I have an interesting question, because I'm sure there's people out there who would have the same question. So a lot of companies, and SCAN is an example, because obviously, full disclosure, Mary Beth and I work for SCAN. So many other businesses are saying to their employees, you either need to be vaccinated or you're not going to work here. Or some places are saying either be vaccinated or be tested every week. So do you feel that being tested every week is a fair way of controlling this situation? I don't know if I'm phrasing that right.
Yeah, so sort of yes and no. I mean, we know that testing can be part of the system to try to figure out who's infected and separate them. The problem is if they come to you to be tested, they may have already exposed you if they're positive. So it's not a perfect system. Much better to be vaccinated. The other catch with testing once a week is that the Delta variant has a shorter incubation period. So it's only 3 or 4 days. So really with Delta, you should be testing twice a week. And
Really?
twice a week's a lot of testing. It's very expensive, and you don't necessarily get the results instantly. So these tests where you don't get the results till the next day, well, yeah,
Like you're sitting home waiting, right?
Either you're sitting home waiting or you're at work exposing everyone.
Or you're not sitting home waiting.
Right.
Yeah, exactly.
Yeah.
You're going out and spreading, potentially spreading infection. So while I think testing is very important, and I especially think it's important if you have any symptoms or if you know you've been exposed, if you know you've been exposed to someone who had COVID, you should get tested 2 to 3 days after your exposure, and again, a week after your exposure to make sure that you're negative. Even if you've been vaccinated, you may need to be tested depending on what kind of exposure. If you're vaccinated, the rules are a little less. If for people fully vaccinated, it's not so necessary that you get tested if you've been exposed. But if you're
Okay.
not vaccinated, it's essential that you get tested.
All right.
And again, that Delta variant is presenting more like that common cold, right? Is that correct?
It's common cold in many people, and we know now that about even a third of adults have no symptoms at all, but are still infected. And if you've already been vaccinated and you have a breakthrough case, you may have very little in the way of symptoms. But Delta is also putting people in the hospital, putting them on ventilators. And in New Jersey, we're still seeing double-digit death numbers. So every day, more than 10 people are dying.
So we have some work to do, don't we?
We do.
Wear your masks and wash your hands.
Yeah. Get vaccinated, get the flu shot, and just generally take care of yourself.
Take care of yourself.
Mind, body, spirit, right?
Stay home if you're sick. Stay home if you're
Yeah.
sick. People always want to take some antipyretics, take some either acetaminophen or take some aspirin or take something so that they'll feel better so they can go out. That's not what you want to do. If your body's telling you you have fever, there's a reason your body's telling you and making you febrile. It's really telling you stay home, stay in bed. Don't make yourself feel better so you can go out, because you're spreading it to other people.
I mean, that's a good point. Don't make yourself feel better so you can go out. You need to make yourself feel better, but while you're doing that, stay in.
Yeah, and
Stay
I
in.
prefer you make yourself feel better with chicken soup and rest, rather than giving yourself medicine that takes away your body's defenses. And fever is one of your body's defenses. Your white cells work much better when your temperature's up, and you can protect yourself better if you don't take away the fever. So we know, for instance, for influenza, if you take away the fever, people shed the virus for a few days longer. And actually, sometimes their illness is a little bit longer. We know for chickenpox, when you gave children medicine to make their fever go away, acetaminophen, they got more pox lesions, about 50 more pox lesions than if you didn't give them fever. And they were sicker for a little bit longer. So don't take away our natural defenses. Fever's our friend.
Interesting.
Listen to your body. If your body says, I don't feel good, stay home.
Listen to your body, but also listen to Dr. Fisher. Please listen to Dr. Fisher. Well, you've really explained, my God, so many excellent things to us today. And I hope that our audience is as appreciative as we are. So Mary Beth, once more, would you kindly, who read your, I want to say, Dr. Fisher, I apologize. You have such an extensive title.
Yeah, it's not so hard. So at Monmouth Medical Center, I'm the medical director of clinical and academic excellence.
Okay.
And at the health department, I'm a special advisor to the Commissioner of Health.
Okay, there you go.
Yeah.
So of course, a special shout out to Monmouth Medical for helping us arrange this visit with Dr. Fisher. So we probably won't see you, I'm thinking, till like in the January timeframe. And I will be very curious, of course, what the holiday season brings. And hopefully in January, we'll have some great news to share.
I hope so too. But we always have information to share.
Yes, that's true.
News.
And it's always a pleasure to see you as well.
You as well. Thank you.
Okay. Thank you very much today, Dr. Fisher. So remember, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone.
Bye. Have a good day. Thanks, Dr. Fisher.
My pleasure.